Well, joining us now on BBC Radio Cambridgeshire is Tamara Keith, who's a GP at the Bottisham Medical Practice. Welcome to the show, Tamara.
Good evening, thanks for having me on.
So first of all, tell me a little bit about what your professional life is like at the moment. I mean, what's this week been like as a GP?
Yeah, so if I just talk you through Monday, if that's okay. So pre-pandemic, we were dealing with about 350, 400 calls on a Monday. This Monday, our surgery took over 1,120 calls through reception. This equates to 1 in 5 of our practice population. The BMA states that a safe number of consultations a day for any GP is around 25. I had 52 patient consultations on Monday. All phone calls were offered a face-to-face if required. I had 3 home visits, 2 care home emergencies, 1 death of a young patient, a suicidal patient, a sick child needing to go to hospital, 2 end-of-life care patients, 3 complaints, 1 case of domestic abuse, and 2 patients shouting to me about delays at Addenbrooke's. One of the reasons we are so intensely busy at the moment is patients are taking about 9 to 12 months to see a specialist. So we are seeing patients repeatedly about the same problem. So if someone comes to me about their knee or hip and obviously needs a knee or hip replacement, they are waiting years. We've got staff in tears, we had patients queuing out of the door on Monday, and we even had our practice manager on reception. As well as all these direct patient contacts, I was also supervising a trainee GP, having to go through all of his consultations and checking all blood results that arrived. I processed over 25 hospital letters, which also then required action. I had 2 patients shouting at me that I wasn't doing anything or wasn't there. I'd been there since 7:30 in the morning, left at 7 in the evening to put my young child to bed, then logged back on to complete documentation. I closed my computer at 9 p.m. I returned at 7:30 on Tuesday and at 6:15 yesterday. We're told there is funding of £250 million, this supposed rescue package. This represents 0.19% of the NHS budget, which is about £3.70 a patient, which equates to 1 minute of extra GP time per person in the UK. This will make absolutely no difference whatsoever.
I mean, as we've been digging down into this today, it does seem that this really is not necessarily addressing the problem at all. It may sound that £250 million is going to help, but what would you say does need to change? If you don't feel this money is going to make any particular difference, what is it that will help address the problems you're facing?
I think the government are completely missing the point here. One of the main issues is the complete lack of care in the community. If there is not care in the community, people can't leave hospital. If people can't leave hospital, A&E is backed up and full because people can't leave A&E to be admitted to hospital. If people can't get into A&E, they come to GP with things they should probably be going to hospital with. The whole system is backed up. The whole NHS needs extra funding. The other problem is they claim that there's lots of extra GPs. There are no extra GPs. GP numbers have fallen every year for the last 5 years, and we're about 2,000 GPs less than we were 5 years ago. All GPs who want to work are working. There's been a great recruitment drive. I compliment that, and we have lots of trainees, of which we have in our practice. However, people are exiting in their droves. People are retiring in their early 50s because morale is so low. And I may sound angry today. I am very angry, and I'm normally a very enthusiastic GP. I am passionate about primary care, but morale is extremely low. We are sick of being blamed for everything that goes wrong in the NHS. Government who seems to have absolutely no interest in listening to us. If any sitting Conservative MP would like to come and sit with me on a Monday, they are most welcome.
I mean, angry may not be the right word. You sound very tired. I'll be honest, you do sound a little worn down, and I can understand why when you list off particularly just one day with all the calls that came in. And I think you said 52 patient contacts. I mean, one of the things that's come up is this idea that there needs to be more face-to-face consulting. I mean, is that practically even possible when you look at how many contacts you're having? And I can only assume that if you can quickly speak to some people on the phone, that is inevitably going to be speedier than face-to-face. But is this something you think would make a difference if it was possible?
Well, if we compare what I'm dealing with now to 2 years ago, we actually did an audit because I was, as you rightly say, a bit exhausted, and I thought, I wonder why. I'm dealing with 100% more patients per day than I was pre-pandemic. I'm actually seeing face-to-face about the same number, but I'm also dealing with about the same number on the phone. So of course it comes out that we're only seeing 50% face-to-face. But actually, if you look at the numbers, we're seeing face-to-face fairly similar. We're talking to a lot more on the phone because we're dealing with about double the workload, which is just, quite shocking, really. And part of the issue is we've got a bit of an Amazon Prime generation. We need to recalibrate what is urgent, be able to fix things yourself at home, use a bit of first aid, go to the pharmacy, not call the GP if you've had sore throat for an hour or a bit of a headache or twisted your ankle, but really recalibrate what is urgent.
It sounds like it sounds like you feel like we need a whole cultural shift. Obviously, investment would be good, but we kind of just need to press reset a little.
Absolutely. And we have patients phoning up to have a sick note who've been off sick for a day. Employers should not be asking for sick notes under those circumstances. People are allowed to self-certify for 7 days. This is creating a huge workload. And people, phoning up about the COVID boosters, I understand that they want more information, but we have absolutely no control over when someone has their COVID booster vaccination. They're sent a letter and they book it themselves. We have no power to change that appointment.
Going forward, seeing as winter is always a difficult time and we can only expect this particular winter to be tough, and there's always a pressure on A&E, do you at least feel like this winter rescue package, it might help in some way if there are some extra locum staff, even if they're not GPs but in other healthcare roles, that it might just alleviate some of the pressure?
If I'm absolutely honest, I think this winter is going to be absolutely dire because the hospitals are already full. We're already at crisis point. Of course, extra funding is welcome, but it really is a drop in the ocean. And there simply are not the extra staff. Everyone is burnt out. They're all working as much as they can. I'm there for 12 or 13 hours a day. When am I supposed to do these extra hours?
Well, thank you very much for your time. And I do hope, obviously you talked us through your day and you said how after you'd put your child to bed, there was normally more work to be done on the computer. I hope that at some point you get a few days to just step away from the screen and the hard work and take a little bit of a break. Is that on the horizon at all?
It is, absolutely. Yeah, I've got some time off over half term. And of course, annual leave is important for us all. But, then we also get criticised and abused by patients for having a day off.
Well, thank you for your time today. Probably not the one thing you wanted to do at the end of the day, really, talk to us for 10 minutes about the health service.
It was just what I wanted to do to get the message across, really.
Thank you very much. Dr. Tamara Keith, GP at the Bottisham Medical Practice, a story I'm sure we'll be hearing a lot more about over the coming weeks and months here on BBC Radio Cambridgeshire.